Our next panel is a virtual panel as well as a real panelist. Uh, this is a session on strategies and practical approaches for incentivizing responsible sharing of clinical trial data. And we really look at the perspective of investigators and leaders in academic medicine and data coordinating centers. And this is a panel that is not synchronous. We have here with us Paula Shireman, who's the Vice Dean for Research at the University of Texas, San Antonio, who's been very active in the CTSA program and is part of an initiative to do coordinated clinical trials. Clay Johnston is the Dean of the School of Medicine at the University of Texas, Austin, and formerly was director of the UCSF Clinical Translational Science Institute. Steve Cummings from the Department of Medicine at UCSF, his wife is having surgery, and I don't actually know if he's going to be able to join us or not. Depends on the timing of her surgery. And then two other panelists. It's a holiday in the UK, I take it. And tomorrow, Rory Collins from Oxford and Karisha Abdul Karim from South Africa will be joining us by WebEx. So this is an important panel. We're looking forward to a vigorous discussion. We're trying to understand how current norms really disincentivize sharing of clinical trial data, particularly in sort of among academic investigators in the medical centers. And we're trying to think through how that might be changed, what kind of incentives might be put in place, particularly if there, we've heard a lot of people saying, well, the culture of academic medicine needs to change to sort of value sharing of data. But beyond that, really be wonderful to sort of hear specific ideas, proposals that have been discussed, that have been tried, that seem promising. So sort of practical steps, if possible. And we're also hoping, and this will come out particularly with the WebEx tomorrow, is to make sure we have a global context in mind, that clinical trials are increasingly multinational, and a lot of trials now taking place in countries that may lack infrastructure and resources. So we're delighted to have this panel. We're hoping to have a vigorous discussion back and forth, which we're looking forward to. And why don't we start with Dr. Shireman and have her talk, and then Clay, if you're on the line, we'll ask you to go next.